So hi, welcome to EpiCentre seminar series. I'm June, and it's our second presentation of the series. Today's speaker is Dr. Emilie, who joined EpiCentre in 2016. She has been involved in teaching epidemiology as well as leading different epidemiology projects. Today, she will present about the use of a One Health approach for surveillance and response in the Pacific community.
Thank you. Thanks, we're good to go. All right. Well, kia ora koutou, and thanks for coming to listen to me talk about One Health in the Pacific and more specifically on how we can support cross-sector collaboration in the region. I thought it would be interesting to start by thinking about what is Pacific Island countries and territories, so we can understand what the One Health approach can bring and how it can be implemented here. Obviously, we're all very aware that the region, and especially island countries and territories, are extremely vulnerable to climate change. And it's rising sea levels, making more floodable areas, threatening inhabited lands, but also unique ecosystems like mangroves. It's more frequent extreme weather events. So think floods and droughts and, for example. And you can add to that that the region is at risk for other natural disasters like earthquakes and volcanoes, like we've seen recently. So it's really a pretty region at risk when it comes to natural hazards. And it's also a region that has its own specific combination of health issues. It is prone to flood-related outbreaks, so leptospirosis and dengue are quite common after floods and tropical cyclones. Also accumulated to a high prevalence of non-communicable diseases, things like diabetes, for example, are quite high in the region, and that is superimposed to a fragile health system. So all of that is affecting the development of all these Pacific Island countries and territories, especially small island developing states. And you can see on this figure that is taken from the Asia Pacific Disaster Report 2022, that when it comes to the Sustainable Development Goals, a lot of progress has been made. Things around hunger and poverty are much better. Health has also improved a lot. Things like industry and innovation have improved, but also some other areas have regressed since 2015, and that's pretty important. Sustainable cities and communities, responsible consumption and production, inequalities have got worse, and access to clean water and sanitation is also worse than it was in 2015. So it's not all great. And we also know that depending on the country, up to 60% of the population could be exposed to multi-hazard risk related disease with climate change. So that's quite a lot of stress that can happen and will happen with climate change, depending on the scenarios. It can be very bad or even worse than this. There are also economic stresses, maybe conflict at times between preservation of the environment and economic interests. You can think about forestry or fisheries. Communities are vulnerable to climate change. The most recent estimates tell us that some countries could lose up to a quarter of their GDP with climate change. And not listed here, but there are also some social issues that has to be accounted for, like gender inequalities that are predicted to become exacerbated with climate change. So it's a region that has its own challenge when it comes to health and climate and the future, basically. Also say a few words about our collaborator on this project. That's the Pacific Community. It's an international development organization, and they define themselves on their website as the principal scientific and technical organization in the Pacific region. So they have been supporting development since 1947. They're owned and governed by 27 country and territory members. They receive funding from a variety of partners, some of the major ones being the European Union, Australia, New Zealand, Foreign Affairs and Trade, as well as France and the US, so several territories in the region. Organized currently in 9 divisions. Some of them are actually transversal. That's really good. They have statistics for development division, so like all the data, they have their own division that works across the different sectors. They also have a specific division for integrated programs. So for that project, we worked closely with the Public Health Division and the Land Resources Division. When I say we, so it's myself, Hart and Naomi Cover from the EpiCentre at Massey. And we worked mostly with Dr. Salah Saketa, who's senior epidemiologist and the lead of that project, and Amy Simpson, who's our team leader, and so they're in the public health division in the surveillance, preparedness, and response program. Amy and Salah are currently at the World One Health Conference, and Salah is actually presenting today on the very same topic, so great timing. And we also worked with Sripat Sosale and Elenoa Salele at the Land Resources Division. I think Sripat said he was going to join today, so it'd be great if he's here. In case you have any question, then he can answer. And we got to work with a lot of other people in different countries, especially, and I'll show you in a minute, we've organized a couple of workshops in countries, so we've got to work a bit more with them also. But that's the core project team. So a little bit more about the background and where it came from. So the SPC, they are part of the COVID-19 Joint Incident Management Team that's funded by the European Union. And the phase 2 is focused on mitigation and recovery. And as part of this, they're exploring the One Health approach via the One Health Security Project that was conducted in 5 pilot countries in the Pacific region, namely Fiji, Vanuatu, Tonga, Samoa, and Solomon Islands. We had some specific objectives for us for contribution to the project. Although the main one was the first one, working on the gaps, needs, and synergies analysis across different sectors in these 5 countries. And there was a lot of emphasis on the cross-sector approach and ideally integration of the different sectors for intelligence and surveillance. I don't think you know what health is, but there are so many definitions that exist at the moment that I think it's important that we state which definitions we have used for the project. We have presented about One Health to various groups with One Health interest during the project in Pacific Island countries. And so that's a definition we've used. It's the 2021 One Health High-Level Expert Panel definition, the one that was designed by this panel as an operational definition for the quadripartite WHO, FAO, and UN Environmental Program. And interestingly, there was a lot of discussion and interest around the use of the word ecosystems in that definition, because that changes from the traditional definition we've heard so far that talk about people, animal, and environment. But here they chose purposely to use the word ecosystem. There was a lot of interest about that terminology and what it actually means for the Pacific and what it would look like and how it could be applied. Lots of questioning and what it would mean for Pacific Islands, because there's some ecosystem specific questions here. Again, I was talking about mangroves. That's typical ecosystem issue. And that's an example of where maybe this definition could be implemented and could work better than previous definition. So what we did, so we combined the results of a surveillance stakeholder and activity mapping exercise during in-country workshops and results of an online survey on One Health gaps and needs with our own observations on when we organized the workshops and when we talked with different people and published frameworks on One Health application to list gaps, needs, and recommendations for Fiji and Tonga specifically, but as well as the whole Pacific region. So, as I said, we conducted these in-country workshops. The idea was to co-construct a common cross-sector vision of the existing surveillance program. And we used a published methodology of stakeholder engagement to map surveillance and identify synergies, gaps, and needs. So because of COVID-19, there were only 2 workshops instead of 5. That would have been great, but we could organize only 2 in Fiji and in Tonga, and the countries were deciding of a theme, application area, and Fiji chose AMR and Tonga chose veritable entities. So for us, the workshops had this very primary goal of mapping the surveillance system, but there were some other objectives for the countries and for the SPC, including networking, both cross sectors within the countries, but also with international groups that provide support. So Fiji working on AMR, they could engage with Combat AMR. Tonga working on vector entities could engage a bit more with Massey and just understand a bit more what support they could get from them. And they also got to work on proposals and budgets, because part of the One Health Security project included some funding for the countries to spend on cross-sector operational research or procurement. Fiji worked on 4 operational programs: communication, animal waste resistance, risk pathways, and integrated surveillance. Tonga focused more on the actual surveillance and procurement, including tablets to help with field data collection and surveillance. And also, although they didn't have a workshop, there was a plan for Samoa to do a thorough survey of leptospirosis, bovine TB, and trichinosis in livestock, although I'm not sure where it's up to. It's supposed to be completed by now, so it'd be good to have an update on this. All right, at the beginning of each workshop, I checked each country's perception of One Health. That's even before I give them any definition or anything, by asking them the 3 words that came to their mind when they heard One Health. There was for the Fiji workshop and Tonga workshop, but the SPC also had their own One Health workshop with the idea of trying to create their own framework, operational framework for themselves when they work in country, how they can implement One Health. So it's really interesting to see the different perceptions. Fiji had a strong focus on the 3 sectors, animal, human, and environment. Tonga had a more holistic view and a transdisciplinary approach, and this idea of that it's working together. SPC were very, very focused on how we actually achieve it in its integration, collaboration, and communication. Somewhere I should appear. So yeah, quite interesting to see that different groups may have different preconceived ideas of what is One Health and what come to their mind. So I'm just going to summarize the main gaps and strengths we identified during the workshops. I won't go through all the details because then we need 2 hours. So that's what the participants themselves came up with when they mapped the current activities and what they were doing and what they think they need else to be able to do what they want. So Fiji said that their main gaps were laboratories, that they had a lack of diagnostic tools, including molecular tools, that they lacked trained capacities, and that their laboratories needed accreditation. In the data area, they lacked sharing between organizations. When the data exists, it is often incomplete, and that they actually need more data from research and development to inform policy. Legislation and regulation was also brought up, that the legislation around antimicrobial usage is inadequate in humans and completely inexistent in animals and agriculture, including for residues in the environment. At the moment, there is no regulation at all. That when it comes to surveillance, governance and collaboration is also a gap at this stage. That the sectors need to collaborate more at a central level, and that when it comes to a surveillance program, they still need to find and define a common objective. And funding is obviously a gap in itself, and how to fund different areas mentioned. But they also had some really good strength when it comes to integrated AMR surveillance. They have the National Antimicrobial Resistance Committee, that's an existing and functioning cross-sector committee, and they have cross-sector technical working groups that have started working together. They're progressing pretty well, and they've had some successful multi-sector activities. Things like running the Antimicrobial Awareness Week, for example, is a really great example of activity that can be done to create links, for example, between sectors. They've been pretty good at identifying and actively engaging supranational partners and build strong relationship with them. For them in AMR, it's Combat AMR, that's a supranational initiative aiming at providing capacity building and training activities in AMR surveillance in partnership with governments. And MR, that's a CSR-led initiative, and they're supporting NARC by helping them build their integrated AMR and usage surveillance system in Fiji. They did say research and development is not enough, but they do have an active research and development sector. And they're involved and they are producing research that can inform policy. During the workshop, we had an example of presentation on research PhD project about the presence of pharmaceutical residuals in the Fijian coastal waters by a student from the University of South Pacific. And that was pretty interesting. There's a type of research that Fiji is producing that can be used to inform their own surveillance. And there's already some data that exists. They do have data on antimicrobial usage. They do have data on antimicrobial import. So the question is, you know, how they can use it and also who has the custody. And that's always a tricky issue. Tonga, so that's again the strengths and gaps that they've identified during their vector-borne disease workshop. The strength they've identified is that they have strong and active environmental health section that is leading the vector surveillance work. They do have laboratory capacity that can help with identifying mosquitoes, for example. They have a strong community involvement, and that's the community, the people, the households, but also the education sector. And during the workshop itself, there were representatives from the education ministry, so that was great. And they've identified 6 main gap areas: a lack of resources, and they were very specific about what they needed: microscope for mosquito identification, traps, tablets for efficient data collection, data analysis, merging, and transportation. So that's partly solved now with the funding from that project. They reported the lack of awareness at all levels, from communities to the important actors, both on the importance of cross-sector collaboration in One Health, but also on the biology of vector-borne disease. Poor capacity is probably a problem everywhere anyway. Not enough people to do what they're supposed to do. Lack of data sharing, and they were also complaining that some organizations have been reluctant to share data. So it's probably a big issue also at the central level when different organizations from the same government don't want to share data. And that's probably linked to that, but there's a lack of legal support with no existing policies or support for the activities that could enable high contribution from the public and the different organizations. But they were also complaining about the fact that it's creating issues for the health and safety for their field staff. And they were also very specific about the fact that the lack of multi-sectoral collaboration was an issue, that it can exist at the decision-making level, but it's not necessarily reflected at the operational levels. And they also went a little bit further during the workshop, and they looked at opportunities and how these gaps could be addressed. And so they've identified training with workshops and online courses for staff, both on vector-borne disease and on multi-sector collaboration. Having policies and SOPs written involving all sectors when they're drafted, and that are specific to Tonga, that take into account the environmental and cultural context there. That there has to be a common vision and goals, and an understanding of all the different sectors' priorities. They also suggested, modeled on the Antimicrobial Awareness Week, a multi-agency reach out program to increase a sense of ownership by the general community, and using media and things like radio or TV. They wanted more transparency and a top-to-bottom approach. That was interesting to note, because it's not necessarily always what is recommended, but for them they considered that a top-to-bottom approach would be the best way for them to engage in multi-sector collaboration, where the CEOs of agencies are approached first and will communicate down, share awareness, but also facilitate collaboration, because then they have the ability to adjust the policies and regulations to support collaboration and even possibly get funding. So that's for the in-country workshop. Now the survey. So we delivered an online questionnaire. That's really not ideal for what we're trying to do, but that was our only option with travel restrictions, and also the fact that we did that study in the first half of this year, and that's, you know, when COVID got crazy everywhere, and many people who were part of our target population were busy. They just basically would not be available even for a phone call. The questions focused on the respondents' awareness and opinions of One Health and on the resources available to them for collaboration. We were hoping that we would be able to analyze the answers quantitatively and look for differences between sectors, between countries, but the number of respondents was just too low to allow anything meaningful there. So it's just going to be descriptive. The SPC themselves distributed the questionnaire via their networks. And so we specifically targeted human and animal health sectors and also the participants to the different workshops that were organized. And the questionnaire was open for 1 month in June. Okay, so most respondents were working for a central government or agency, and 9% were from academia. And important to note, although not surprising, we didn't have anyone from private sector. Most respondents were from Fiji, 11, and 11 from the human health sector. But we also had respondents from Tonga, Samoa, and Vanuatu, respondents of 22. A large majority knew about One Health, and 2/3 had received specific training, so that shows a good awareness. But again, it's not very surprising, and it probably reflects selection bias and you know, who we could reach and who would take the time to respond to this survey at that time were probably people who already knew about it and knew of the importance of it. But only a quarter of them reported routinely collaborating with their agencies. So at least this is one figure that's probably quite reliable here. We know collaboration, routine collaboration is not that common. Overall, the respondents had very favorable opinions of One Health. Again, not surprising. 3/4 reported wanting more collaboration, and 81% of those who reported engaging in collaboration found it beneficial to their work. We also asked about what support they had for collaboration. We asked if there was a go-to person in their agency for collaboration and if they had policies encouraging or supporting collaboration. And nearly half of the respondents reported that there was a go-to person for collaboration where they worked, but around 1/3 did not know if there was such a person. And also more than half did not know if there were policies encouraging collaboration in their agency. So maybe support exists, but people are not aware of it. But that's quite important, and it's quite annoying that they don't know. Having a go-to person can facilitate collaboration because they act as the communication hub, and they can put relevant people and agencies in contact, and it makes it easier if someone wants to initiate collaboration. If they know, okay, I'm supposed to email that person or call that person, then it makes it much easier than trying to figure out who they're supposed to approach first. And in a similar way, policies are very important because without it, then it looks like collaboration is some extra work, it's a side work. And if it's not part of the job description, then it can appear that it's something staff has to do in their free time. And we know how time-taking it can be. So if it's not even encouraged or recognized, then it can definitely be a barrier to collaboration. And to finish with the survey, we asked participants what they thought were barriers and factors for success for cross-sector collaboration based on their own experience with collaboration. And so what they've listed as barriers included commitment problems. So that's fitting collaboration with daily workloads. That's, sorry, that's, yeah, working extra time or having to do all these phone calls at night. Then identifying the right person to approach when they were working with an agency they've never worked with, and the lack of harmony between agency policies. That included how to spend funds. And it's always, I guess, a problem when you collaborate between sectors. There will always be one leading agency who will be the one that will receive and spend the funding, and then the others become collaborators. So it's not necessarily, it doesn't become a co-governed project when it's done like that. There were also some things that they said was helping them when they were collaborating. Things like opportunities for communication and discussion. And they did list the One Health workshops that were organized as part of this project as a really good thing that helped them meet people and discuss with people and make plans and generate ideas. The ability to share information easily when it can happen is really, really important. The eagerness and willingness to collaborate of the people involved was also listed as important. And obviously adequate funding were reported as important. So as part of this project, the overall project, we came up with 7 recommendations to enhance the use of One Health for surveillance, responses, and operational research. So that's based, it's, we say it's for the region, but technically it's based on 5 pilot countries, and mostly Fiji and Tonga, that were those who contributed the most data. So it may not be very relevant, or at least not the main priorities for other countries. We've had discussion with, for example, Papua New Guinea were telling us that some of these, they were okay, they were important, but for them, there were other issues that were probably more pressing. For example, around involving private sector and the forestry sector, for example, that was not really mentioned in our survey. So that's it's really important to take that as a pilot work, and these are general areas, but that's work in progress basically. So these 7 areas we came up with to enhance the use of One Health for surveillance, response, and operational research. First, to promote One Health approach through awareness campaign training, including on the principles of cross-sector health. How do we actually work better together? To strengthen the capacity and capability within the sectors, animal and environmental health, but in particular the veterinary profession that should be developed in Pacific Islands. Some countries are not too bad. In Fiji, they have veterinarians, including private vets, but other countries, there's just no single vet in the country. So it's really needed to develop the sector, and vets and paravets that are present should have access to field veterinary epidemiology training. Does exist for vets and paravets. And it's important for public health, but also for food security. If you think about, livestock health, doesn't need to be zoonotic disease. Health and production are really important. The third point was to develop and involve the environmental sector with an objective of establishing healthy environments and ecosystems, as per the definition that we talked about earlier. And as we said at the beginning, the effect of climate change and anthropogenic stressors on the environment is really exacerbated in the Pacific, probably more than anywhere else in the world. So it's definitely the region that could lead the way in integrating the environmental sector in the One Health approach, I think. The fourth point was to support laboratory capacity building and accreditation. The ability for laboratories to work across sectors would be great. Otherwise, working as a network of labs would at least facilitate data sharing. Developing policies and strategies, encouraging collaboration at the central level, but also locally, it's important. And the policy should be transparent and known to all employees and staff. support to data sharing between sector within a country and also between countries. And that's actually where the SPC is really doing a great job. They have several networks. They have the Pacific Public Health and Surveillance Network that has different activities and data sharing networks, and whether it's syndromic or even based surveillance, and they could certainly relatively easily extend that to include animal health and environment, for example, climate data. And so they have the platform basically already exists for doing that between countries, but somehow within countries it's not as developed. And the final recommendation we made was to support the setup of national cross-sector committees to facilitate governance. And the NARC, the Antimicrobial Resistance Committee in Fiji, is a really good example of how it can be done successfully. And they have volunteered to help other countries do that and help them with writing terms of reference and missions and strategies. And that would include funding for sustainability. It's always a very big issue. And these committees, when they're set up, they need support from the sectors, the individual sectors themselves, and they need to have the adequate policies that allow each sector to actually add to the collaboration and allow them to share resources and jointly spend funds. And that's apparently more difficult than I would have thought it would be. We've presented quite a bit about this project, and it's been interesting to see how it was received and the interest it received. And we did contribute to increase awareness of the One Health concept and its application. We did 3 blocks of presentations in Fiji, Tonga, and with the SPC on One Health and how will you work across sectors and how you use the One Health concept to do operational research. But we've also had lots of opportunities to disseminate these results. There's a final report. It is supposed to be available publicly at some stage on the SPC website. I don't know if it's the case yet or not. But we've also done a lot of presentations. The SPC had a One Health Planetary Health workshop back in July, I think it was. Last month, I presented at the Pacific Public Health and Surveillance Network meeting. The SPC, as I said, they're presenting today at the World One Health Congress, but also during the different workshops and meetings, the countries themselves, the 5 countries, presented on their own experience on One Health and their own perception of the concept and how easy it is to implement it or not. And at the PPHSN meeting, there was also a panel discussion on how this human public health network could actually adopt the One Health approach and how it could bring value to the work they're doing. And to finish, some reflection on where now. I think it's really important to build on the momentum and the interest, especially after the PPHSN meeting. They've showed their interest to expand the survey more from the countries that have already responded, but also to more countries, and even if possible, add an additional survey for the private sector. If possible, to do it face-to-face, we would reach more people and understand a bit more the complexity of the issue. It's important to prioritize One Health goals and resources, and to come up with a Pacific One Health definition and a framework, what exactly it means for the region. It's not the same as what it means in North America, for example. And finally, the SPC themselves, I suspect they'll be interested in progressing this work. They've just released their new strategic plan for up to 2031, and they have planetary health as one of their 7 key focus areas. And they recognize One Health as an integral component of planetary health. So I suspect and I hope they'll keep working on this in the future. That's all. Thank you.
Thank you, Emilie, for your great presentation, and thank you all of you to join our seminar series. So I will distribute the next seminar, our notification about the next seminar soon. And until next time, see you guys. Bye.